I was an amateur for most of my career. I did win the U.S. Mid-Amateur in 1995. I played in the Masters in 96. 95, I was the number 2 amateur in the world behind Tiger. I played U.S. Opens, Senior Opens. Most of my stuff I did as an amateur. When I was taught how to swing the golf club, it was completely different, where you put a lot of pressure on your back and your hip. Especially golfers, it's the left hip. Over time, it just wore down where it was bone on bone, and it was like someone was sticking a sword in my left hip, just shooting pain on the inside of the leg. Got to where I had trouble walking. Well, I actually found out about Dr. Minotti through a client of mine. I was giving him a lesson, and he asked me, he said, "What's wrong? I can see something's wrong the way you're walking." And I said to him, "I need to get my left hip replaced. Not sure what to do or who to say." And he said to me, he said, "I'll tell you the best guy around." And he gave me Dr. Minotti's name.
It struck me that this is a gentleman whose body was now limiting his ability to do what he is best at. So I felt like the pressure was on me to make sure that this gentleman got a hip that could put him back in his, in his desired competition level. And we did. He did wonderful.
A few weeks after I had the surgery, my brother, who has a house in Florida, called me up and said, "Hey, Jerry, why don't you come down to Florida with me? You can drive the cart and help me with my game." And I said to him, "Well, Richard, I don't know if I can go or not." So I said, "Let me call Dr. Minotti up." So he says, "Yeah, of course you can go. Why can't you? It's 2-3 weeks." And I said to him, I said, "I know, I can't go in the water and I can't play." I just remember him saying, "Well, I didn't say you couldn't play." So I actually went down there 3 weeks from the day of the surgery. So I was swinging a golf club and playing.
Early return to function is, I guess, the primary reason why people are enthusiastic about the anterior approach.
What I found for the recipe for success to have a hip replaced is first finding the right doctor, which I did with Dr. Minotti. Second, finding the right place to go, which I did with Griffin Hospital. And third, having the anterior hip replacement surgery. Since the surgery, the game, has gotten better, and it's a lot more fun playing without pain.
Griffin Health, empowering people, advancing care.